So right now I'm going to talk to you about the restless leg syndrome, RLS. This is the most common disorder that has been seen in the women after the pregnancy. But the female have uncontrollable urge to move the leg. The female will try to, when the female is trying to sleep, she will have a pinch-like sensation in the lower portion of the leg, and she will try to move the leg again and again, again and again, again and again. So this condition is known as the RLS. So basically, what happened in the RLS? We don't know the main cause of the RLS, but we know that there are several medical conditions or several things that can cause the RLS. For example, if you take the excessive caffeine to our body, that can cause RLS because it will increase the epinephrine, and so which will eventually make our body into the flight and fight hormone. So that's why it can cause the RLS. And the second option, if the female have sleep deprivation, so it will also cause the sleep like RLS. If the female is taking antidepressants, so it can cause RLS. If the female have taking antihistamine, it can also cause the RLS. If the female is taking anti-epileptic drugs, it can also cause the RLS. And but it can also cause it is also seen in the male, but in male are the chances are very low. And the treatment, like there is a no specific medication, but we try to give different kind of a medication to the in case of the RLS, because we don't know the etiology. So what will happen, we give a specific kind of a medication that is known as the dopamine antagonist. Dopamine antagonists mean they are replicating the natural functionality of the dopamine, but they are not natural dopamine. So that's why we call it dopamine antagonist. So in dopamine antagonist, the first line of treatment of the RLS is the pramipexole. We can give 0.25 milligram, and we can reach to the 0.75 milligram depending upon the patient weight and body structure and the fat deposition. And the next, we can give carbidopa, levodopa, like 25 milligram slash 100 milligram, 50 milligram, 50 milligram slash 100 milligram. So this is the dopamine, levodopa, carbidopa, and if it will indirectly increase the dopamine level in the in between the synapses, so it will reduce the RLS symptoms. Then we can give gabapentin, and in gabapentin also do the same functionality because it is a medication that is related to the neurons. So it will also reduce the urge to move the leg. And we can also give the benzodiazepine, specifically clonazepam in that case too. It will also help. And we can also give the opioids, for example oxycodone, so it will also help in that case. So that's how you can treat the RLS. It is commonly seen in the females. Yeah, I missed to tell you the main point. Basically, if the female have low level of the ferritin level, specifically ferritin in the blood, so that female can have RLS. You will do the CBC and you will check that if any kind of there is a drastic change in the ferritin levels. So you can, and if that female have the RLS, so that means the RLS is caused by the low level of the ferritin, and in that case you can give the iron supplements. So it will treat the medication, it will treat the condition without any kind of a medication. And if you after testing and the patient have normal level of the ferritin level, so you can go to for the pramipexole 0.5 milligram to 0.75 milligram, levodopa, carbidopa, gabapentin, benzodiazepine, clonazepam, and opioids, oxycodone. So yeah, this is how the RLS. You have to remember that RLS is seen in the female after the pregnancy or low level of the ferritin level in the blood. The female have uncontrollable urge to move the leg during the sleeping, or they will feel a sensation like the lower portion of the body. So this is the RLS, and this is how you treat it. Thank you. Goodbye.